Section 22B, Fitness Assessment. 22.3, Fitness Assessment Procedures. Adequate physical fitness levels ensure every airman can properly support the Air Force mission while performing at optimal capacity. All components of the fitness assessment must be completed within a 3-hour window on the same day. If extenuating circumstances occur, for example, rapidly changing or severe weather conditions, natural disasters, emergencies, or safety issues, then all components must be completed within 5 duty days. The body composition component is the first component of the fitness assessment. It includes measuring height, weight, and abdominal circumference. The muscular fitness components, push-ups and sit-ups, may be accomplished before or after the aerobic fitness component. There is a minimum 3-minute rest period between components. Note: the assessment components should be scheduled to allow adequate rest for members on irregular or shift work hours. Also, reserve members must be in a duty status for fitness assessments. Fitness Screening Questionnaire. A fitness screening questionnaire will be completed no earlier than 30 calendar days, 90 days for Air Reserve component, but no later than 7 days prior to the fitness assessment to provide time for medical evaluation when indicated. Failure to complete the fitness screening questionnaire does not invalidate the fitness assessment. 22.4 Fitness Assessment Score. The composite fitness scores are used to determine the overall fitness assessment score. Aerobic fitness is evaluated by the 1.5-mile timed run or alternative aerobic test. Body composition is evaluated by abdominal circumference measurements. Muscular fitness is evaluated by the number of push-ups completed within 1 minute and the number of sit-ups completed within 1 minute. The maximum eligible points or component scores for each category are 60 points for aerobic fitness, 20 points for body composition, 10 points for push-ups, 10 points for sit-ups. Minimum scores. The minimum component scores are established to ensure members test adequately in all components. Meeting the minimum score in each of the components does not constitute the minimum points required to earn a passing fitness assessment score. Scoring the minimum component values in all components will not generate enough points to earn a composite score of 75 or greater. Age and gender-specific fitness assessment score charts are provided in AFI 36-2905 Fitness Program, Attachment 10. Note: when reviewing the charts, make note of both the minimum and maximum requirements associated with specific categories to assess progress and tailor training to strive for higher scores in each of the components for overall fitness assessment results and personal fitness levels. Fitness assessment results. There are 3 fitness assessment levels that can be achieved, as well as an exempt category briefly described here. Excellent. To achieve a fitness assessment level of excellent, a composite score at or above 90 is required. If all 4 applicable components of the fitness assessment were scored at or above 90, the individual will retest within 12 months. If 3 or less components of the fitness assessment were scored at or above 90, and the individual is not on a chronic profile, then the individual will retest within 6 months. Satisfactory. To achieve a fitness assessment level of satisfactory, a composite score at or above 75 to 89.99 is required. The individual will retest within 6 months. Unsatisfactory. To achieve a fitness assessment level of unsatisfactory, a composite score below 75 and/or 1 or more component minimums was not met. The individual will retest within 90 days. Exempt. Airmen must be exempt in all 4 components to be entered into the exempt category. 22.5 Documenting assessment failures. Assessment failures will be annotated in Air Force Fitness Management System 2, AFFMS2, and will be considered against the individual. If a member fails their fitness assessment, the commander has the discretion to annotate a non-current or failing assessment within the reporting period on the evaluation. Additionally, it is the commander's discretion to document the evaluation as a referral for a non-current or failing assessment at the evaluation closeout date. Commander responses for fitness assessment failures range from verbal counseling to placement on control roster to administrative separation. A more complete list of commander response options for fitness assessment failures is provided in AFI 36-2905. Deployments. Composite scores represent a health-based fitness level. As the fitness level increases, airmen are able to tolerate extremes in temperature, fatigue, and stress while optimizing performance in the deployed environment. Members must have a current fitness score on file prior to deployment. Members will not be considered exempt in the deployed location until their current fitness assessment expires. Medical exemptions and profiles. Medical providers may recommend temporary or permanent medical exemptions for medical conditions preventing an airman from safely participating in specific physical conditioning programs or in a component of the fitness assessment. The commander, in consultation with the fitness program manager and upon medical provider recommendation, may grant members exemption from aerobic and muscle fitness components for a limited period of time. Exemptions for medical reasons are entered into AFFMS2 using the individual's current AF Form 469 Duty Limiting Condition Report, following assessment completion. Airmen with a medical profile prohibiting them from performing one or more of the components of the fitness assessment will still be tested on the components not specifically exempted. For additional details on fitness assessments, refer to AFI 36-2905. 22.6 Fitness Assessment Components Explained. To assess total fitness, the fitness assessment components include body composition, muscular fitness, to include push-ups and sit-ups, and aerobic fitness. Body composition. Body composition is the relative portion of the body comprised of fat and fat-free tissue. The two largest contributing factors to maintaining a positive body composition are exercise and a healthy diet. There is no quick way to improve body composition, but it can be done safely with time, patience, and perseverance. A combination of exercise and nutrition is the best way to reduce body fat and maintain a healthy weight. Losing 1 to 2 pounds a week is a realistic goal best accomplished by eating better and exercising more. Muscular fitness. Muscular fitness includes both muscular strength and muscular endurance. Muscular strength is the maximum force generated by a specific muscle or muscle group. Muscular endurance is the ability of a muscle group to execute repeated contractions over a period of sufficient time to cause muscular fatigue. Muscular fitness helps with metabolism, strengthens connective tissue, increases bone density, helps facilitate recovery from physical activity, helps prevent injury, may increase cardiorespiratory fitness, and may improve mood and self-image. Muscular fitness resistance training includes performing calisthenics, plyometrics, field exercises, and weight object training such as machines, free weights, medicine balls, kettlebells, bands, cables, and ropes. Movement patterns can include running, bending, twisting, squatting, pulling, and pushing. Body regions that can be targeted include core, lower body, upper body, and whole body. By incorporating a variety of combinations of muscular fitness resistance training, weight object training, and movement patterns, a wide range of exercises are available for a challenging, engaging workout routine. Aerobic fitness. Cardiorespiratory endurance, known as aerobic fitness, is the ability to perform large muscle, dynamic, moderate to high-intensity exercise for prolonged periods. Performance of such exercise depends on the functional state of the respiratory, cardiovascular, and skeletal muscle systems, more simply defined as the ability to produce energy. Many modes of activity meet aerobic activity requirements, such as cross-country skiing, running, cycling, swimming, skating, rowing, walking, aerobic dance, indoor aerobic exercise machines, and sports that require continuous physical exertion. The level of aerobic fitness determines how long and how hard a person can exercise. Moderately intense aerobic activity. Moderately intense aerobic activity equates to continuous exercise that raises heart and respiratory rates, initiates sweating, varies with climate, and permits conversation or controlled breathing. Aim for at least 30 minutes a day, 5 days a week. Vigorously intense aerobic activity. Vigorously intense aerobic activity elicits higher physiological responses and permits light or broken conversation. Aim for at least 20 to 25 minutes a day, 3 days a week. Intensity calculations. Intensity, considered the most important variable in training, can be measured by the percentage of maximal oxygen consumed or by the percentage of maximal heart rate. Various approaches are available for calculating training intensity. Air Force fitness personnel can help determine calculations to safely achieve individual fitness preferences and objectives. The key thing to remember when exercising is to elevate your heart rate to a safe level to achieve the desired training effect. Also, adjustments in mode, frequency, duration, and intensity may be necessary to reach higher levels of health and fitness. 22.7 Additional fitness concepts and principles. There are several additional fitness principles that should be applied to a fitness routine. Fitness routines do not need to be complicated. They can be simplified, tailored to individual needs, and designed to address certain concepts to help maximize training efforts and benefits. Pre-workout warm-up. Warm-ups help increase body temperature and blood flow and guard against muscle, tendon, and ligament strains. Before beginning any vigorous physical activity, prepare your body for exercise with a warm-up. A 5 to 7 minute dynamic warm-up increases the flow of blood to the muscles and tendons, thus helping reduce the risk of injury and increasing the joint's range of motion, positively affecting the speed of muscular contraction. A recommended sequence of dynamic warm-up activities before vigorous exercise is provided here. Slowly jog in place or walk to generate a gradual increase in the heart rate, blood pressure, circulation, and temperature of the active muscles. Slowly rotate joints to gradually increase their range of motion. Slowly mimic the activities to be performed. When warming up for weightlifting, lifting lighter weights helps prepare the neuromuscular pathways. Post-workout cool-down. Cool-downs provide a gradual reduction in activity to prevent blood pooling, hasten recovery, and avoid injury. After a workout, take a few minutes to gradually bring your body back to its normal resting state by slowly decreasing the intensity of your activity. A few examples of how to cool down after a workout are provided here. After a run, jog slowly and then walk for 1 to 2 minutes. Do this while rehydrating to cool down without allowing the blood to pool in the muscles and reducing blood flow to the heart and brain. Repeat activities similar to those done in the warm-up to help ease muscle tension and soreness. Flexibility training. Flexibility is considered to be the maximum ability to move a joint freely without pain through a range of motion. Although flexibility is not assessed during the fitness assessment, it is an important aspect of overall health and should be part of a well-balanced physical activity routine. Two aspects of flexibility are stability and mobility. Stability deals with maintaining non-movement functional positions, including postural stability. Mobility deals with controlled functional movement through an active range of motion in the various planes of motion. Stretching. Stretching is one form of exercise that takes very little time relative to the benefits gained and may be done easily at home or work. Repetitive movements at work or a more sedentary job can increase tension in specific muscle groups, which would benefit from mild stretching during the course of the day. Stretch when the muscles, tendons, ligaments, and connective tissue are warmer, above normal body temperature, and hold stretches for 10 to 30 seconds. Repeat each stretch 3 to 4 times. Ballistic stretching, bouncing, is not recommended. Also, after a workout, the muscles are warm from activity and should not be overstretched. Principle of specificity. Target specific muscle groups or target areas by doing a simple assessment of functional movement. By incorporating specific moves into a strength training program, Airmen can improve strength and improve work-related tasks while reducing injuries by conditioning muscles needed to perform on the job. An airman whose job requires lifting objects from the ground and moving them to overhead locations has a work-related task that is equivalent to the functional movement of a squat and an overhead press with a weight. Principle of regularity. Exercise routinely to produce a training effect. Establishing a routine of 3 workouts per week is best for optimal gains. Airmen should strive for exercising all target muscle groups at least twice each week. Some airmen may maintain a moderate level of strength by doing proper strength workouts once a week for a short period of time after a strong baseline level of muscular fitness is established. Principle of recovery. Allow at least a 48-hour recovery period between workouts for the same muscle groups. A way to do this and maintain an active fitness routine is to train leg muscles with weights on Monday, Wednesday, and Friday, and train upper body muscles on Tuesday, Thursday, and Saturday. Also, consider recovery times during a workout. The recovery time between different exercises and sets depends in part on the intensity of the workout. Normally, the recovery time between sets should range from 30 seconds to 3 minutes. Principle of balance. When developing a strength training program, remember the importance of including exercises to work all the major muscle groups in both the upper and lower body. Also, most muscles are organized into opposing pairs. Therefore, activating one muscle results in a pulling motion, while activating the opposing muscle results in the opposite, or pushing motion. When planning a training session, one training technique is to follow a pushing exercise with a pulling exercise, resulting in movement at the same joints. For example, following an overhead press with a lateral pull-down exercise helps ensure good strength balance between opposing muscle groups, which may in turn reduce the risk of injury. Principle of variety. Using different equipment, changing the exercises, and altering the volume and intensity of workouts are good ways to add variety and may also produce better results. Periodically substitute different exercises for given muscle groups. Do squats with a barbell instead of leg presses on a weight machine. Also, for variety, or when workout equipment is limited, switch to partner-resisted exercises or another form of resistance training.